Hi everyone, welcome back to my channel. My name is Dr. Vignan. I'm a sports medicine doctor, triathlon and running coach. Along with this, I also run a sports rehab clinic. So since the lockdown started, since COVID has started, I've been getting a lot of people with neck pains and lower back pain. And today I want to talk to you about the reasons for lower back pain and also how you can and what exercises you can do to prevent lower back pain and to treat lower back pain. So first, let's start by talking about the most common cause of lower back pain that I see visiting my clinic. So the most common cause that I've seen is muscle strain. So when you're sitting for prolonged periods of time, what tends to happen is that the leg, the glute muscles, the hamstring muscles, the blood flow to these muscles reduces. Because of this, you tend to get a lot of pain in this area, and because of that tightness, there's a pull on the lower back. Same thing can happen with the above the hip muscles as well. These are the muscles like quadratus lumborum and the erector spinae group of muscles. Because of that pull, you tend to get this area where there's a lot of tightness from above and from below, and the pain tends to increase. The next common reason that I see in my clinic is sciatica. So sciatica pain is when there is pain along the sciatic nerve. So the sciatic nerve is a nerve that originates at the lower part of the spine and it runs down the back of your legs. It's one of the thickest nerves in the body, and pain would feel like a dragging, a radiating pain that goes towards your calf muscle. So if you're feeling that kind of pain, it's very likely that you have sciatic pain as well. The next common cause of pain that I've seen coming into my clinic is spinal compression. So what happens is either the vertebral bodies are compressing on the spinal nerves. This compression will cause some numbness and tingling over that area. So people tend to get numbness and tingling around the back on that where the compression is, just around that area, or they get numbness and tingling radiating down the legs. So what you feel like is you feel like ants are crawling up your legs, and many people who tend to face this, they feel like surgery is the only option for them. However, me and many physiotherapists who have sort of treated this have realized that you should at least give an attempt for physiotherapy before you go down the surgical road. So the last cause that I want to talk about, and it's very common in this society right now, is because we're not moving around, we're not active as we are supposed to be. We're very stagnated in our jobs, and because of that, we're getting a lot of weakness in our core muscles. So because of weakness in the core muscles, we're not stabilizing the joints, or we're not stabilizing when our body moves, and this can lead to lower back pain as well. So one of the easiest ways to treat this is just to do core strengthening. So I'm also going to talk about how you can strengthen your core. I like to keep things very basic and very simple. So I'm going to give you simple exercises that you can do. And if you want to take it up to the next level, please feel free to reach out to me and I'll help you out with that. So next up, I'm going to talk about how you can set up your desk ergonomically so that you're not getting back pain. First of all, try to have a good setup. You want to ensure that your eyes are at the top of the monitor so that you're not straining too much when you're looking down at the screen. You're not bending your neck too much. This can cause upper back pain, which eventually leads to lower back pain in some people. Now, the next thing that you want to do is ensure that your back is completely rested up against the chair. Ensure that your hips and your knees are at 90-degree angles. Your feet are on the ground, they're not reaching, you're not trying to reach the floor with your toes. Neither are your heels too in contact with the ground. By being too close to the ground or too far from the ground, you can change the load on your glute muscles. You can increase the load on your glute muscles, which then causes tightness. And like I discussed earlier, that's going to cause pain in your lower back as well. So ergonomic, ensure that you've got an ergonomic setup. You might also consider getting a standing desk, or just put like a mini desk on top of your existing desk. What this allows you to do is you can sit for maybe 20-25 minutes, you can stand for 5 minutes and work for a while. This will ensure that you're distributing the load that you have over your lower back, and in the long run, it's going to help you prevent back pain as well. Another tip that I like to give athletes and patients of mine is to limit yourself to sitting for 20 to 25 minutes and then take a 5-minute walk. So this has been a huge tip for many people because we tend to take long calls, we tend to take long video calls, we're sitting in front of our laptops or in front of our desktop systems for prolonged periods of time. So instead, consider taking short breaks and go for a walk so that you're getting recovered and the load and the tightness in the muscles is getting reduced. Next up, another thing that I like to do is if your work allows it, it's not a work where you have to be constantly in front of your system, you can download a Chrome extension that actually blacks out your screen. What that's going to do is force you to take a 2 to 3 minute break. It's also going to give your eyes a break so that you're rested up and you're fresh, and also it's a good way to work this way because you're not getting too stressed out because of work. So another tip that I found very useful for me is when I'm taking video calls or calls for a long period of time where I only have to listen to the audio mostly, I like to take it over a Bluetooth headset, or I like to take it over my phone so that I can walk around while taking the call. This avoids me from sitting down. It's getting a lot of blood flow moving into the legs, and it's going to prevent injuries in the long run. Now, the next two tips I've given to a couple of patients of mine who used to have chronic back pain for long periods of time. What I told them was try sitting on a yoga ball. So you get these yoga ball chairs and you also get yoga balls especially. So sitting on these, because yoga balls are moving structures, what that's going to do is force your core, force your muscles to keep in motion. When the muscles are continuously in motion, it's going to prevent you from getting injured in the long run. So try out the yoga ball tip especially and let me know if it works out for you. If you're liking the video so far, a subscribe would be immense because I would get so motivated to make more videos, and I make videos every week. So please do consider subscribing. So next I want to talk a little bit about stretching. Before we get into the stretches that I want to do, let's talk about what stretches are. So stretches should be held for between 6 to 10 seconds minimum. Most ideally, if you have the time, stretch for longer than 10 seconds. We're going to talk about sitting stretches, and then we're going to talk about lying down stretches. Sitting stretches are stretches that you can do while sitting on your chair. You can do these stretches once every hour and do the stretch maybe one time, hold each stretch for 10 seconds. So the first one that I like to do is the sitting side stretch. This helps you to stretch out the oblique muscles and will help with the lower back and prevent the tightness. Also helps you to loosen up the core muscles that will prevent you from getting injured. Next up, I do the sitting figure of 4 stretch. What this does is loosens up the piriformis muscles and the glute muscles. So the piriformis muscle is very important because in many of my patients, I've seen that they have a tight or swollen piriformis muscle. So stretching that muscle out definitely helps a lot. Next up, you can also do the seated hamstring stretch. Sit down on your chair, stretch out the hamstring muscle, and that's going to prevent tightness in the hamstring and reduce the chance of lower back pain. Doing a forward fold also helps you to relieve pain along the whole of the spinal column. The muscles that are along the sides of the spinal column, those get relieved, and because of that, you're going to avoid pain as well. Alright, so let's talk about the lying down stretches. You can do these stretches maybe once every 90 minutes or once every 2 hours, or whenever you get off your chair for a while. So one of my favorite stretches for stretching the hamstring is the lying down hamstring stretch. This helps you to stretch the hamstring, and in some people it helps you to stretch the calf muscle as well. The next stretch that you want to do is the lying down piriformis stretch. You can also do the figure 4 piriformis stretch while lying down. This will help you to stretch the piriformis and the glute muscles and prevent tightness in those muscles. The next stretch is the lying trunk rotation stretch. This is going to loosen up the core muscles, especially the lower back core muscles, and it's going to prevent tightness over those muscles. The last 2 stretches are the prayer stretch and the lateral prayer stretch. So the prayer stretch will help you to loosen up the muscles all along the spinal cord, on the sides of the spinal cord, and the lateral prayer stretch will add in quadratus lumborum as well, along with oblique muscles, which are the core muscles. That's going to prevent injury and tightness in the core muscles. Lastly, I'm going to talk about long-term solutions that can help for you. So first of all, if you're having chronic long-term or you're having lower back pain from a long time, consider seeing a doctor or consider talking to a therapist. You can also get massages to relieve the myofascial triggers and the muscle triggers that you're having in your lower back or in the glute muscles. That's going to benefit you, and that's going to help you to reduce lower back pain a lot. Along with this, consider working on core strength as well. So what are the exercises that you can do for core strength? One of my favorite exercises for core strength is to do the plank. So you can keep something very basic and then build up from there. So start with something like 3 times 10 seconds of a plank and do it and keep doing it until you're getting to about 30 seconds. Take a break between each repetition. You take a break of about 45 seconds to 1 minute. Another workout that you can do is to strengthen your back muscles by doing back raises. You can do something very simple like 3 times 10. Take a break of again 45 seconds to 1 minute. That's all I have for you today. Please do like, share and subscribe to my channel. I'll see you next week.